Welcome to Navigating Lyme Disease for Patients and Doctors. I'm here with Dr. Daniel Cameron, and today we are on episode 5 and focusing on chapter 3 of his book, An Expert's Guide on Navigating Lyme Disease, where we talk about Babesia primarily, and in a following episode, we'll get to other co-infections as well. Dr. Cameron, thanks so much for being here.
Very happy to be with you tonight.
You know, one of the biggest misconceptions about Lyme disease is that it is a single disease. And I think people think, well, if I've got Lyme disease, that's what it's called. And the fact of the matter is that is not the case, is it?
Right. Lyme disease was named originally after Lyme, Connecticut, where they said, well, there's a spirochete. Dr. Bergdorfer discovered a spirochete in the belly of a tick. And so, everybody has the attention with one organism, one disease, one problem. But they've discovered more than a dozen different things in a tick that are viruses, bacteria, atypical bacteria. And so I'd say over time, even though we might use the word Lyme disease, it's often referred to a tick-borne illness. So whenever you're Lyme, you've got to remember that there's other bacteria to keep in mind. And so today, I think you wanted to ask more about this particular parasite called Babesia. It's hard to believe that you're getting bit, you think it's a bacteria or a virus, and you just overlook that a tick could have easily introduced a parasite.
And that's the thing. Another thing that I think is also a big misconception is so much of what we're talking about when it comes to Lyme disease, or how we think of it, is that it's actually a parasite in many cases that's introduced into the body. Isn't that right?
Yeah, a parasite, we normally know malaria, in Africa, and that you don't normally have to think about malaria. Or you might think of parasites in the gut that you might pick up something, and so you take a stool sample to the doctor. But that's more of gut issues, diarrhea issues, stomach pain. But this particular parasite is in the blood. So when that parasite is in the tick and it bites you, it would like to go to the red blood cells and might stay as a parasite in the red blood cells. In fact, if you're sick, sometimes it's so severe you're in the hospital and they can actually see the Babesia parasite in the red blood cells under the microscope. And if it's that bad, often it breaks up the red blood cells and you end up with hemolysis. Might end up with severe anemia. That is also considered a deadly type of a presentation. And it's just that there's so many other people that have Babesia where it isn't caught in the ER. It's not caught in the hospital. In fact, they're not sick enough to go to the hospital. And so but they still have a problem. It's hard to identify the Babesia. It's a parasite. You just can't see it so easily in the red blood cell.
So talk a little bit about what Babesia, what kinds of symptoms we see when somebody has contracted the Babesia parasite.
Well, some doctors focus in on that first presentation, that first time in the ER where they have severe anemia, the red cells are breaking out, they might need life support, they might be in critical care, those kind of things. It's just that if you don't notice that, then it's driven by the same immune system, the same fight or flight that you see in Lyme disease. So you end up with a very similar list, and you're sitting there thinking, is it Lyme? Is it Babesia? Is it anaplasmosis? But you run into you get into the immune system where it's so active, people are typically fatigued, they can't sleep, they have poor concentration, they have headache, pressure, lightheadedness, joint pain, everything we're talking about. And so many of the symptoms, when you stack them all up, are the same. And now Babesia is frustrating is that just when you think you got to worry about Lyme and that's it, you can have both infections at the same time from the same tick. And all the focus is on the Lyme part, the Borrelia part, but that patient's sitting there with Babesia at the same time, and that's part of their illness, part of why they're sick, part of why they're frustrating you because the doxycycline isn't working.
And that is a really big issue in terms of, I imagine, why so many patients go so long with symptoms, even though they may be being treated for one symptom or one disease state, Lyme. They may not be being treated for Babesia. Is that right?
Yeah. There's a focus for some doctors on just that first week, but there's plenty of people who have never acutely sick. They just have a PCR, which is a DNA test. Then they have antibody tests, but they're not that reliable. So you get people who don't have any of those tests. They don't see it on the red cells. They don't see it on their DNA or antibodies. In fact, there's a problem because the Babesia is in the red blood cells, or at least in the liquid, the serum. And when you draw blood, donate blood, the only way you even know that person has Babesia is because they donate blood and the recipient gets Babesia from the donor. And so we do know through that mechanism that you can have Babesia in your body and none of the tests show it, and you're sick. And you're sitting there thinking, why doesn't doxycycline work? Well, it doesn't work for a parasite.
So talk just a second about the difference between what you're terming as Lyme disease versus what you Babesia.
Well, Lyme disease proper is that Borrelia, that spirochete. But in a broader sense, when a doctor says Lyme disease, they're usually referring to someone sick where they think it's Lyme disease. But when you've been in the field for a while, you realize that there's like a cesspool. There's over a dozen things in that tick. And so we kind of loosely use that four-letter word, Lyme. And it's a four-letter word partly because it isn't very nice to have it. But today I'm referring more to one of those infections that are in a tick. And so it's just time to focus in on how important just one part of that Lyme disease umbrella term is, and that's Babesia.
So for a patient who has maybe even been diagnosed for Lyme disease, who's not getting better, the doctor doesn't quite know what to do, how do we help them to find out if Babesia is an issue?
Well, how I approach it is if you have a lot of sweats, because it's a parasite, or went through sweats and they cleared up, you might think about it. You might think about it if they have air hunger. And that's, of course, a tough thing to diagnose because they always think that's anxiety. You have to be aware that half the people don't have sweats, so you still have to be thinking about it. And I usually find I don't worry too much about Babesia if they don't have sweats, they don't have air hunger, and they get better in 3 weeks. But even without the sweats, if they're still sick and it's a month has passed, 2 months passed, you're trying doxycycline, you're trying other kind of antibiotics like Zithromax, or you might be trying the amoxicillin family, then think about Babesia. Or if they're really sick, within 3 weeks, I start at least being aware of what else is in a tick and make sure I at least look into Babesia. And fairly often I end up treating someone if I don't like the progress I'm making with treating for a spirochetes or treating for some of the other bacteria.
On the other hand, there's the doctors who may have found Lyme disease, found spirochetes, but have not found Babesia, and it turns out for the patient that they're working with that is an issue. How do we help them to find that more easily or to consider it more often?
Well, there's an assumption that if you have Lyme disease, or at least tick-borne illness, sometimes they say Lyme disease and tick-borne illnesses, is that if you're sick and continue to be sick, instead of only giving up or saying, well, 1 out of 3 people are sick, is that looking again at some of the other things in that tick, you'll find that you're missing an opportunity to treat somebody. It just so happens that this is totally different, an unexpected parasite that, people kind of miss that golden opportunity to find the treatment that's going to work instead of just writing them off.
I think the other thing that we should talk a little bit about is a broader range of symptoms that occur with Babesia. So give our audience an idea of the range of symptoms, understanding that some present, some don't, and it's a case-by-case basis.
Well, I should mention that one of the reasons doctors don't go very far with Babesia is that it was first thought to be asymptomatic. That is, they don't have symptoms. So no matter how many symptoms you have, they always said, oh, that's asymptomatic Babesia. That's all you got. But in practice, if you look, you're going to find an awful lot of people who are chronically sick where asymptomatic doesn't apply. They're symptomatic. The traditional treatment for spirochetes and Lyme aren't working. So if you look at that, the kind of Babesia patients I see, their immune system is busy. It's been busy for some time. And that's where with that fight or flight type presentation, that's where that fatigue pops up in almost everybody. They're too wired, they can't sleep, they wake up tired. There's so much going on with the neurotransmitters with that kind of illness that every mood button's turned up. So they often will say, well, I don't know why I have rage. I don't know why I have anxiety, sadness, despair. The sensory system is turned up. All the neurotransmitters for being light sensitive, sensitive to hearing, sometimes even heat and cold. There's something called autonomic nervous system, which I talk about a lot. They sometimes call it POTS, positional orthostatic tachycardia. Even that's off. And sometimes, everybody thinks, well, Lyme and all the tick-borne illnesses are joints. We surprise how often the joints aren't even the biggest issue, and they might be an issue, but it's mostly these psych issues, sensory issues, and type fatigue, sleep, and plus there's head pressure, like up here, there's sometimes pain around the eyes. Pretty much the same list you might see with the traditional Lyme. It's just that it's just a parasite. It's just a different way of getting to the same illness.
And the issue becomes that even though they may be presenting the same way, the treatment is very different, isn't it?
Yeah, this parasite in the bloodstream, from Babesia, there's treatment. Now, it used to be clindamycin and quinine. Quinine, a lot of people have heard about quinine for malaria, but quinine had a lot of side effects, a lot of hematology problems, and clindamycin itself had a fair amount of diarrhea and problems. So almost half the people who took that for Babesia got fairly sick from the treatment. So there's a Dr. Krause who years ago, with a lot of the colleagues, found that if you treat with a different combination, they tolerated it well. They did as well, but boy, they could just take it and not suffer. So that's where you run into something called the tobacone, which is in the field been used a lot for malaria. It's also used when someone travels to Africa to prevent malaria, and they have a lot less side effects than this other malaria medicine, the one that you take once a week, called mefloquine. So in America, they advertise, they market the tobacone as Malarone and Mepron. Malarone is a pill that has 250 milligrams of tobacone in and some proguanil. Mepron is pure atovaquone. And so I tend to use the Malarone more because it's a pill. It's a little lower dose, 250, and then I go up if I need to. Some of my colleagues often start with a teaspoon of atovaquone, which is 750 milligrams. So, I've done both. But the convenience of a pill versus this yellow, murky liquid atovaquone, it's a great way to start for me, knowing I can always go to the higher dose later on. And since I often have a lot of people I intervene early on, I find that it just is better and simpler and straightforward to always remember that there's a simple pill alternative to it. It's also generic right out. It's been on the market for so long that, so do like the Good RX, you can get it for about $110 for a month, 2 a day. It's 2 a day, whereas prevention of malaria is once a day. So that, so sometimes it's not covered by insurance because they say it's travel medicine, but still 2 times a day with Good RX is $110 isn't bad, especially for a whole month. So that's certainly helped a great deal. It used to be $2,000, and $100 is a lot better, more manageable.
Just to refresh, we're on Chapter 3, Babesia and other co-infections. And on Topic 2, one of the things that you mentioned is that Babesia is more common than we think. Talk a little bit about how common it is.
Well, it used to be that people would focus in on some tick things called Ehrlichia, Ehrlichia, and anaplasmosis, but Babesia is probably at least as common. So, maybe as many as a quarter, a third could have Babesia in there, in that tick. Now, how many are sick? There's certainly plenty that are sick. Now, I keep talking today about Borrelia microti because I'm on the East Coast. I'm in New York. I practice in New York. But there's also plenty of Babesia in the West Coast. But they have a particular strain called Babesia duncani that they identified. But the way ticks are is they don't cooperate. They don't stay in one place. If you identified Lyme in Lyme, Connecticut, it's certainly everywhere else. And if you identify Babesia microti in one area, they're mixing up more than you think. So the chance of getting Babesia are much higher than one would think. You'd think it's rare, but it's not.
How many people have some form of Babesia and never have an issue that they are aware of? Asymptomatic, as you mentioned earlier.
Well, I think the original studies always said that 1 out of 3 Lyme patients treated with doxycycline or standard treatment were still sick years later. So those are the patients I target the most. If they're sick, oftentimes the missing link for those patients is Babesia. But I'm sure there's some Babesia cases that are asymptomatic because they're, they wouldn't be seeing me. Now, one of the reasons I know they're out there is that they're people who are screened by the blood bank and are healthy. They completely pass the blood bank. Their blood's in the blood supply, and the doctor gives a transfusion, and the child gets Babesia, or whoever the recipient is.
When you look at the East Coast and the West Coast versions, are you aware of any major differences in how the two present?
Well, the people on the West Coast says that their Babesia duncani is harder to treat than the East Coast. But I could tell you that there's plenty of people on the East Coast where it's a challenge. They might have to get retreated. They originally said, 10 days works. Well, 10 days of treatment for Babesia works to get rid of the parasite from the red cells. But I don't find that 10 days is enough for a symptomatic patient. Now, if they get better quickly, it's great. But I often have to go longer, and and alpha have to treat Lyme at the same time, because that tick has more than one thing in it.
Let's talk about a couple of cases that you mentioned in chapter 3. The first one is topic number 1. The 85-year-old man dies after a sudden onset of hearing loss. Talk a little bit about how Babesia brought this on and its role in his death.
Well, in his case, is that he was quite sick. He had some liver function tests, but they found it on a bone marrow biopsy. So in this case, they didn't just see the Babesia in the red cells. They saw it in terms of what they call tetrads. A tetrad is finding you see in malaria. It just so happens the same thing as seen in Babesia. And there was another 2 cases that were in another part of the book where the person left the United States, went out to the Asia, and they thought those tetrads were there, that it must be malaria. But after extensive workup, they realized, oh no, that was somebody who caught